This is Dave. Today we're going to talk about something that literally has been documented for hundreds of years, but we're starting to see more and more cases. For whatever reason, there's a lot of theories post-COVID. It's functional neurological disease. And several different things actually fit into it. You can see weakness to the point of they've had children that have sat down and went to get up and fallen flat on their face because their legs are paralyzed. Movement disorders where you're getting tremors that are not medication related, not Parkinson's related. Blackouts, seizures that are not hooked into epilepsy or traumatic brain injury, anything like that. Sensory symptoms where you're more sensitive to temperature, you're more sensitive to the touch on your skin, but only in certain areas or on one side of the body. They all are being lumped and fall into this functional neurological disease category. The kicker is there is really no disease process occurring in the body, in the organs of the body, or in structural areas of the body, like the skin, like the muscle, like the bone. So you can do all the labs in the world that you want. They're going to come back most likely normal. CTs, MRIs may show absolutely nothing, but you still are going through these symptoms and these processes with no known cause. And that is what the question mark is. What is going on? It's functional neurological symptom disorder can be broken down into conversion disorder, functional movement disorder. The second most common reason now to see a neurologist outside of migraine headaches is functional movement disorder. Again, yeah, you need to go see the doctor. You need to go see the specialist, because if it is something else, you can do things to help out in a lot of cases to get treated. However, here you're pretty limited as far as what can be done. Something else that you can see is limb weakness or paralysis. Like I said, in most cases, the paralysis does go away. I actually had a friend of mine whose daughter suddenly legs gave out. Very active, young teenage daughter. Took her to Children's over in Denver, drove like the dickens to get over there. Nothing. Couldn't find a doggone thing. Thankfully, a year later, she's up doing everything that she was before. So that is one positive thing that you can see here. So, but the other things that we're breaking down into, like I said, is tremors, jerks, and they're like sudden jerks that will occur for no reason. Vision changes, like double vision, weakness in your eyes, so you're not seeing as good as you once were, and almost like glaucoma symptoms where your side vision is not, your peripheral vision is not near what it was, and it's going even worse. Hearing loss. Everybody's got hearing loss. I've got hearing loss. Ask my wife. But this is pronounced and it's not slowly occurring. It's like within 2 weeks, suddenly your hearing is going downhill. Cognitive issues can also be seen, where you were once functioning with no problems or issues, and all of a sudden it's going downhill. Again, if you do a CT scan with somebody with dementia, you're going to see Lewy bodies, you're going to see plaques forming, but in this situation, it's not there. Speech impairments, where you're seeing stuttering, slurring of words, or whispering. That's also lumped into functional neurological disease. Dizziness and balance impairment. That is very common with inner ear issues. However, if you go into the doctor, there's nothing there, it could be this. And again, sensory disorders, like I said, where one side of the body may be very sensitive to touch, to temperature, both hot and cold. The other side is fine, but boy, you touch me on this side and it just lights me up because it's painful. it again could be lumped into the functional neurological disease. Again, the tests that you can do basically rule out some of the major things. Like I said, Lewy bodies, dementia, Parkinson's, MS, MD. You want to get that ruled out, but they do not show anything as far as a disease process that is occurring here. Like I said, this disease was talked about over 200 years ago. In the 1800s, it was documented. So it is not something new due to COVID or whatever is going on. And there have been theories that, it's social media involved, because in kids, they mention it, so therefore kids are experiencing it out of sympathy. If one kid has it, oh man, I have that going on. That's exactly going on. So suddenly this kid has it. Possibly yes, because obviously we have more social media now. It could be like a Munchausen's type disease where that's going on. However, it has been going on for 200 years. So not necessarily. You are more prone to see this if you have a history of childhood abuse or neglect, if you have a history of trauma, if you have a history, like a military history where you have experienced PTSD, that can happen. Rarely, but it has been seen after general anesthesia. So that may make you more prone to seeing this. It is more common in females than in males. And it is triggered by injury, and stress can make the symptoms worse. So be aware of that. If you have other illnesses such as depression, psychosis, fibromyalgia, irritable bowel syndrome, any autoimmune diseases, migraines, epilepsy, you could also be experiencing some of this associated with that. Like I said, there is no disease process going on, so it's very difficult to treat. However, you do need to get in to see your provider, who may refer you to a specialist, because there are a lot of disease states that we need to rule out that can be treated, and that it is imperative you get in early, because the earlier that some of these can be found out, the better your treatment, the better outcomes can occur. But if you are suffering from functional neurological disease, there are some things that can be done as well. Number one, seeing a therapist or a psychiatrist can help you out. They have seen better outcomes when you're involved mentally with somebody to improve your outcome with this mind over matter type situation. Okay? Physical therapy and occupational therapy are also huge helps, especially, like I mentioned, when you have muscle weakness, you have sensory disorder on one side or in one area. Those kind of therapists can do wonders with you and build that muscles back up, retrain your mind and your body to use things differently. Depending on what's going on, seizure medications can help out. Absolutely, an antidepressant or an anti-anxiety med can help, because, hello, you're dealing with something that is very difficult. It's okay to be on an antidepressant to help you out until your mind, your body recovers. Pain meds can help out. If you're going through the sensory stimuli where it's painful on one area of your body, that can help out. Speech therapy, if you're going through the speech impairments, they can do wonders too, especially because it's frustrating to you, because you're trying to say things. You think you're saying things, but something else is coming out. A speech therapist can work wonders. And check with your insurance. Most of these therapies that I've described should be covered for you. And as well as psychological cognitive behavioral therapy. I'm going to repeat that again. Psychological cognitive behavioral therapy. It's a specialty that actually works with patients going through this, because there is so much involved there, both psychologically as well as functionally, with your muscles and things going on in that regard. Do not hesitate to reach out to some of these therapists to get help. There is a lot that can be done for you.